Hey guys, and welcome. We're talking about changing and challenging cognitive distortions, also known as cognitive biases, irrational thoughts, or thinking errors. Challenging them is an important step in improving your mental health and overall well being. So, cognitive distortions are patterns of thinking that are inaccurate or irrational and can lead to negative behaviors. So, here are a few ways that you can begin to address these thinking patterns. Awareness. The first step is to become aware of your cognitive distortions. In this video series, there is a video dedicated to types of cognitive distortions. Pay attention to your thoughts and emotions, especially when you're experiencing high levels of stress, anxiety, or negative feelings. Recognize patterns of thinking that may not be based in reality or match extremes, as we previously discussed. Identify specific distortions. Learn to recognize the different types of cognitive distortions. There are many cognitive distortions, including all or nothing thinking, overgeneralization, mental filtering, catastrophizing, personalization, and more. Understand the specific cognitive distortions you tend to use. It can help you address them most effectively. Most people do not use all of the distortions, rather there are a few which you might employ across situations. Start to challenge your thoughts. When you notice a cognitive distortion, question the validity of the thought. Ask yourself, is this really true? Do I have any concrete, tangible evidence to support it? Are there alternative explanations or perspectives? Can I reframe this or think of this in another way? For example, if you find yourself catastrophizing, thinking that the worst will happen, challenge that thought by asking if there's any evidence to support the catastrophic outcome, or if there is room to kind of expect something variant to happen. Therapeutic mindfulness can be helpful. Practice mindfulness to stay in the present moment and to avoid getting lost in distorted thinking patterns. Mindfulness techniques such as meditation, deep breathing can help you to observe your thoughts without judgment and develop a more balanced perspective. Also note that mindfulness as a therapeutic process is a little bit different than mindfulness as a spiritual practice. So if that's something you're interested in, make sure you know those differences and govern yourself accordingly. Keep a thought journal. Maintaining a thought journal where you record your distorted thoughts and situations in which they occur, as well as alternative, more rational thoughts, can be really helpful. The journal can help you track your thought patterns and work on changing them over time. This practice helps you become familiar with reframing, and it helps with the mastery of these concepts as they become easier with repetition. Seek external feedback. Talk to a trusted, I highlight here trusted, family member, friend, spiritual leader, or therapist about your cognitive distortions. Sometimes an outside perspective can help you see things more clearly and challenge that distorted thinking. CBT also can be really helpful. Consider working with a therapist who specializes in cognitive behavioral therapy, which is a structured approach that can help you identify, change cognitive distortions through guided exercises and discussions. One thing that I also find helpful is positive affirmations. Counteract negative thought patterns with positive affirmations so you can replace that negative self-talk with more positive and more realistic statements. For example, if you tend to overgeneralize, remind yourself of specific instances that contradict that generalization. When you have an automatic negative thought, you can use positivity to interrupt that pattern of thinking to change it. Understand this change will be gradual. Cognitive distortions develop over time, and so you have to offer yourself grace and be patient with yourself because it takes time to develop a new, healthier pattern or practice of thinking. Make sure you're being compassionate to yourself and understand that everybody experiences these distortions from time to time. This is part of being human. So don't judge yourself too harshly for having these thoughts. Instead, when you have them, acknowledge them and focus on changing them. And then you can use cognitive restructuring, which is a specific CBT technique that involves systematically challenging and restructuring your distorted thoughts. You examine the evidence for and against your thoughts, and then you create a more balanced and realistic belief. Changing cognitive distortions is an ongoing process that requires self-awareness and effort. By practicing these techniques and seeking professional help when needed, you can develop a more balanced and rational way of thinking, which can lead to improved mental health and well-being overall. Lastly, while I am a licensed mental health professional, I might not be your licensed mental health professional. So please use this information for educational purposes. And if you notice these cognitive distortions, please reach out to a trained professional for additional help. Again, shout out to all my new subscribers. And if you find this information helpful, please like, share, subscribe, comment, do all of the things that you know to do on YouTube.